Hello, my name is Heather Neal and I'm the Executive Director of the TrackSAFE Foundation. TrackSAFE is a harm prevention charity established by the Australasian Railway Association and UGL to reduce fatalities and injuries on the network and improve the well-being of the rail workforce. I'd like to begin by acknowledging the traditional owners of the lands at which we meet. For me here in Canberra, it's the Ngunnawal people, and I pay my respects to elders past, present and emerging. From today's webinar, I hope you'll have tools to which you can add to your wellbeing toolbox as we move to living with COVID-19. Please post any questions that you have for our guest in the question pane on the right-hand side of the screen, and I'll be posing them to Mostapha as we progress through the presentation. And just a reminder, if anything in the discussion triggers issues for you today, please reach out to a friend, a family, colleagues, the Employment Assistance Program in your organisation, or of course Lifeline is always there for you on 13 11 14. Now let me please introduce our guest, Mostapha Kourouche. Mostapha is the Health and Safety Partner at Transport for New South Wales. He's passionate about suicide prevention and the promotion of health and wellbeing in the rail workforce. Mostapha, let's start by you telling us a little bit about yourself and how you've come to be such a strong advocate for mental health.
This discussion. Really excited to share some of the hints and tips that I've been able to pick up along the way. I've been working in the rail industry for the last 18 years. I've held a variety of roles, so from health and wellbeing, I'm currently in safety. I've held roles in return to work, HR, recruitment, project management, so really a diverse background and skill set. I'm really passionate about this particular area because I feel the more that we talk about it, the more we can raise the awareness, we can break down the barriers and some of the stigma that surrounds it. And I think that we'll be better able to handle some of those tough situations that we're faced with. We can improve our relationships, whether it be with work colleagues or family members or even our friends, and hopefully putting that all together to be able to lead a life that is a bit more fulfilling, a bit more satisfying, and one hopefully that's really enjoyable.
You've been working at home and had a whole lot of different arrangements in your family over recent months. What have you and your family been doing to try and manage the COVID-19 blues?
Look, it has been a little bit of a tricky time. I've been working at home during the pandemic, and actually I've found that there's been quite a few positives that have come out of working from home. For me, I've been able to spend a bit more time with my family. In times gone by where I had to commute to and from the office, I'd leave pretty early in the day and come back generally pretty late. I've been able to hone my cooking and culinary skills. We've been, as a family, doing a lot of cooking together. So I've had my kids help me out in the kitchen and cutting up some veggies and doing all sorts of different things. We've also tried to find some ways to be a bit more active. We've been, on plenty of bike rides. We've explored our local area, and I mean, with the tough lockdowns that we've had, we haven't really been able to socialise and visit most of our family and friends. So just trying to be a little bit creative about that. When the Olympics were on, we've got an athletics track around the corner from our place. We went and held our own little family Olympics. So yeah, just really trying to spend a lot more time with each other. We're actually able to talk a little bit more about things that are bothering us or challenging for us. We've been pretty creative with our Zoom parties and catching up with our family and friends. We've had trivia nights, we've had some birthday parties, and even cracked open some of those dusty board games as well that have been hiding in the cupboard. So been pretty good to get back to some of the old activities that we used to do pre all of the technology and things that are available.
You just mentioned pre-technology. Can you talk a little bit about the role of technology in mental health and resilience?
Look, I think there's a really huge role to be had with technology at the moment. And I think the fact that we have a whole stack of resources that are available at the touch of, a button at our fingertips. We're always carrying our smartphones everywhere we go. And so if we needed to find some information about some particular things, there's mindfulness and meditation apps. There's the great Rail Res app, which you can access and download, which has a lot of great tools and tips in there. So being able to utilize technology at this time is really fantastic. We're able to learn a lot more information, and also a really great way to be connected. I know we're currently quite distant in terms of physically, but socially we can be really connected. We can obviously reach many people across the country just by jumping in and having a chat like we are today.
You were talking about your family, and you've been doing a whole lot of things which really you weren't doing previously as a family, spending much more time together, being much more inventive in how you use your local park during the Olympics. So do you think as we, into 2022 and life returns back perhaps to a little bit like what it was before, or a lot like what it was before, do you think you'll be keeping some of those activities and routines? And if so, why? And if not, why not?
Yeah, I think definitely we want to try and keep doing a lot of those things, like especially the bike rides. So I found that we've been able to really bond. It's helped us to keep our fitness up and our activity levels up. The good friends of yours, those magpies, have been a little bit troublesome over the last couple of months, but certainly we've been able to explore plenty of things and learning about the great sites and things that are around where I live. So definitely want to keep doing those. We've been very active, so hopefully trying to keep those as part of our routine going forward. In terms of doing the things that we were doing, we having a family night on Friday, focusing on board games, has been great, because we get to test each other out and see what our limits are. The kids are learning what it's like to win and lose, which has been good. So yeah, hopefully keeping those things in play as much as possible.
You've had a change in your work arrangements, and because of COVID-19, and so for many people, they're working at home. They've had homeschooling, lots of things happening, and we know that over the coming few months, for many people, there'll be lots more changes to their work arrangements. What are the tips that you've got for managing sort of the apprehension and anxiety that people might have with this change?
Yeah, I think it's going to be a really interesting time for a lot of people. I think, where possible, try and return to some of those routines that we would do. Changes in terms of the pandemic. So, I mentioned I was saving a lot of time from not having to commute. So if commuting was one of the things that you had to get back to, try and really get back into those routines as much as you can. So one of the things I've been trying to do before I start my work days, I'm actually leaving the house. Even though I am working at home, I'm leaving the house, walk out the front door. I'll either walk around the block or walk up and down the street, to give me an opportunity to say, okay, well, at least I'm travelling towards, the rail station or to the office. When I'm having a break, normally during my work day, I walk out and get a coffee or something and come back. So I'm trying to mix up my day and do some of those things. In terms of being a little bit apprehensive, being back in an environment, I think one of the things that we should really encourage people to do is have a conversation with your leaders, your managers, your team. Let them know what it is that you're apprehensive about, and maybe you can come up with some sort of strategies to work on in order to help you to feel a bit more comfortable when you're returning back to the office or to your work locations. I really encourage a lot of people to try and focus on the things that you can control rather than things that you can't. So, things like practicing your own personal hand hygiene and keeping safe and all those sorts of things. As long as you're managing the things that you can control, I think that will help you out. And certainly, as you mentioned right at the start, many of you can speak to your EAP provider, and they can give you some guidance and some tips on how you can prepare your mindset prior to going back into your workplaces.
You mentioned routine, and can you talk a little bit more about the role of routine, exercise, sleep, and connecting with people in managing fatigue and building and maintaining your resilience?
Yeah, it's a really great question. I think, Heather, when we're in a routine, we're quite comfortable. We're able to manage a lot of the important aspects of our lives. When we lose that routine, we find ourselves losing a bit of focus. We find ourselves with some different habits starting to form. Our patterns of the different times of day tend to shift. So if you're not having a great night's sleep, you might wake up a little bit earlier, or you might wake up a little bit later. And because of that, you might not have your breakfast at the right time. And then because of that, that shifts, the holding patterns as the days move along. So you find yourself eating a little bit later. You find yourselves maybe not having enough time or the energy to exercise. You're finding yourself that you're not able to focus. You're probably a little bit less alert to the things that are going on around you, and not being able to be focused on your own emotion and your feelings, and recognizing when you're a little bit too tired or you're irritable. So it's really important that we are trying to manage our routines as best as possible. So putting in some sleep routine and prep for your sleep is really important, because that will ensure that you're feeling revitalized, you're feeling energetic and ready to tackle the day ahead. So some of those things include not having a really heavy meal too close to your bedtime, not engaging in high energy exercise or moderate to high level of activity close to your bedtime, so at least a couple of hours before you go to sleep. Trying to avoid technology. I know we're all enjoying our Netflix and our TV series that we've been really glued to over the last few months during this pandemic, but really trying to avoid a little bit of that screen time. So maybe about an hour before you go to sleep, trying to limit your screen time, maybe move away from that blue light. I think that's really important. Doing some mindfulness or some breathing and some real relaxation activities before you go to sleep really create a nice and calm environment for you to really be comfortable when you are having that sleep. So somewhere between 18 and maybe 22, 23 degrees should be the temperature of your bedroom. Having the blinds covering so that your light isn't coming in. I know outside of my place I've got a street light that sits right outside my bedroom window, so if the blinds aren't on blackout, that light comes in and it keeps me away. And then maybe even limiting your caffeine to I don't know, for me, trying not to have any caffeine about 6 hours before I go to sleep tends to work okay for me, but everyone's a little bit different. But really, if we're managing that sleep, I think that really sets us up for success over the coming days, and it really gives us that energy and motivation to want to exercise, to eat well, to prepare our meals, to do all those things that for us are really helpful to be our best self.
Again, just a reminder to people, please be putting your questions for Mostapha into the question pane on the right-hand side of your screen. I know, Mostapha, when you and I have spoken before, we've talked a little bit about shift workers and the particular challenges that they have in maintaining not only a healthy lifestyle but good mental health just as a consequence of their work arrangements. Likewise, people who live alone can also sort of slip into some patterns which aren't setting themselves up for success. Have you got any particular tips for people who are living alone or working shift work, particularly as we move into this next phase?
Yeah, shift workers really find themselves in a challenging time. I was a shift worker myself once upon a time, and I mean, as a young person doing shift work, it was very difficult for me. So I can only imagine people who've been doing it for quite a long time, and of course, people in the rail industry. That tends to be a lot of where that work is focused. I think one of the things, if I can think about a situation that I sort of went through, and maybe some of the troubles that might come with that, and then maybe some strategies to support that. Is what I'll probably talk about here. But I remember when I started working in the rail industry, I was only 21. A lot of my friends were celebrating their birthdays and going out on weekends and all sorts of different things. And I mean, as a shift worker, there was a lot of times where I would say, sorry guys, I can't make it. Got work this weekend, or yeah, I can't make it. Sorry guys, I've got work. And so it also impacted my sporting. I was playing competitive sport. Oh, sorry guys, I can't play this week. I've got work on the weekend, or sorry, I can't make training. What tends to happen is, you fall a little bit out of those social circles. You fall out of those sporting communities. You fall out of those connected communities that you tend to have. So you have to make a bit more of a special effort. You find that those invitations to the events, they stop coming through. They stop asking you to come to practice. They stop asking you to come to the games. They say, oh, maybe you can be the filling guy. And then you turn down that opportunity when they ask you, oh, we're really short this week, we really need you. So you tend to, fall out of those social connections. And if we're not putting that effort in, it's really difficult to maintain that connection. And being isolated can impact and I guess really exacerbate those feelings that we might be in this current period. So some of the things that I'd really encourage you to do is try and connect. Send a text message to your friends, family, making sure that they're connecting with you. And if you have friends and family who are also shift workers, try and connect with them and really reach out to them. And one of the things that have been really great to see is people who work in that industry tend to stick together. And so having those conversations, whether they be in passing or maybe scheduling some time with your colleague who might be on the same roster as you, to really have some time to check in with each other and see how you're managing and coping. Just because you're a shift worker and you might be sleeping hours that are different to others, it doesn't mean that you can't still have a social life. It doesn't mean that you still can't participate in sporting activities. I really found that when I was working shift work, it was great for my golf game because whilst most of my mates were working during the day, I was able to go to the golf course and have a bit of a hit around. And I have to say my golf handicap really benefited from that. So you can still do a lot of that stuff, but really have to make that effort. So scheduling some time in, really making that effort to make sure that you're having those connections. Some of the things that you have to also consider is what I was talking before about that sleep and managing that sleep hygiene. The same is still relevant, even if you're trying to go to sleep during the day. You're still making sure that your room is really dark, making sure that it's a cool, comfortable environment. You're wearing loose-fitting clothing when you're having that sleep so that you can fall into a nice deep sleep as well. So just some of the things that we can really work towards to ensure that we're looking after ourselves and really managing our mental health during that period too.
We know that men are less likely to seek help, whether it's for their physical health or their mental health. Have you got any particular messages for men that are on the line today?
I really encourage you to have a chat. There are plenty of support lines. There's the men's shed. There's the men's line. Speak to mates. Um, I guess blokes tend to want to talk about things that they're really interested in, whether it's their footy team or whether it's their soccer team or the cricket or whatever it might be that is an interest to you. Building, engineering, race cars. Find a topic that you're interested in. Find a topic that your mates are interested in. Use that as the catalyst to begin a dialogue, begin that conversation. And then once you're in that conversation, check in with each other. Ask how their week's been. Ask how they're coping. Ask, what they've been doing. Have they been looking after themselves? If you yourself are struggling, if you yourself are worried about things that might have changed for you, your attitude towards different things, you're not wanting to participate, you're not as energetic, you don't have the same drive that you once had, it's really time to put your hand up and say, hey, I'm struggling with this. And like I mentioned, a couple of those lines, support lines that you can reach out to can certainly help you and guide you in the right direction to be able to get that help and support. One of the things that I think a lot of people take for granted is the GP. They have a GP, they don't really see them that often. Go and see your GP. The GP can put you in touch with some of the networks that they have and can really guide you on the best way to get whatever support it is that you need, whether it be for a physical health check or whether it be for a mental health check. It's really important that we do reach out and have those conversations.
Of course, it's good to do that sort of thing proactively before you may be having some issues, and just staying on top of both your physical and your mental health. But sometimes, things aren't tracking so well. What are some of the signs that people should be looking for or noticing about themselves that will give them that extra impetus to actually make that call to the GP or the other services that you're talking about?
Yeah, great question, Heather. I think one thing that we really need to understand about ourselves is that we all have a baseline, okay? The way that we present every single day, our normal, if you like. So when I wake up, I'm feeling a particular way, and that's how I present every day. So for me, I'm the sort of guy who's quite outgoing. I tell some really bad dad jokes. And having conversations with my friends, I really like to have a laugh. I do like to engage in sporting activities. And so if, for me, I'm seeing or feeling that I'm not sticking with that baseline, I'm no longer participating in those sporting activities, I'm no longer mingling, hanging out with my friends, if I'm not telling those really bad dad jokes, for me personally, I know that I'm not doing those things. If I'm not sleeping, if I'm not feeling as energetic, for example, or if I'm finding difficulty getting to sleep, they're the sorts of things that I'm taking note personally of myself. But also if you're noticing that of people around you. So I think some of the things that we're looking for, I guess if we categorize them in three key areas, one is, what are you saying? Are you talking in a way that's not your usual self? Are you talking in a negative light? Are you talking your negative self-talk? I'm hopeless. I'm not achieving. I'm not, causing. I'm not doing things that are resulting in some good things. It's the way that the language is. Maybe I'm not telling those jokes, or I'm not participating in conversation. So it's the things that we're saying. But then also a bit about our behaviour. What are we doing? Are we withdrawing? Are we a little bit erratic? Are we, moody, snapping in terms of our behaviour? Are we acting recklessly? Are we taking shortcuts when we don't normally? Are we taking risks where we wouldn't necessarily be? Things like that in terms of our behaviour, our patterns, not sleeping, things like that. And then maybe around the personal circumstances that might be going on in your life. And so there could be some financial pressures, there could be some health concerns, there could be some relationship issues. So all of those things might be indicators for us to say that, maybe I'm not traveling that well. Maybe there is a bit of an issue. Maybe I'm not dealing with things like I would normally do. Maybe I'm not energetic or enthusiastic in my approach to things. So I think if we're noticing some of those things, then it's really up to us to take that step and say, I'm not doing okay. There's things going on. But similarly, if you're noticing your friends, family, or colleagues who are expressing those changes away from their baseline, then step in there and say, hey, I've noticed, I have seen. And I guess when you say, I have seen, then it allows the person to see it in a more personal note and say, okay, well, I get it. You've seen it, you've noticed it. A lot of times we tend to put a mask on and we just try and put a brave face and we go, yeah, I'm fine, I'm fantastic. Don't worry about me, I'm coping, I'm resilient, I'm all good. So, yeah, sometimes it could be that we're not noticing it, but someone else is. And it's important that if you do notice it, please tell somebody. Please go over there and say, hey, how are you going? I just thought maybe we should have a conversation. The other really important thing to do is to have regular check-ins. So come back to that person and say, hey, I know I spoke to you last week. I know we talked about, what was going on for you, relationship issue or job issue or whatever it might be. How are you going today? Did you seek some support? Did you speak to anyone about it? Do you know we have some great services available? Maybe the person is not really ready to go and speak to somebody, or maybe they just need someone to be with them, to help them and support them and take them away with them on that journey to be able to have that conversation.
As a manager, you're obviously got the interest of the mental health of your team members. But to actually give help to others, you really need to be mentally healthy yourselves. What are your tips for managers to look after themselves, build their own resilience, but also be confident in actually safely talking about mental health with their team?
It's hard to believe, but managers are people too. They do have the same feelings. They will be impacted by the same things that their staff are. I think one of the really important things as a leader to do is to have a really good relationship with your staff. Speak to them regularly, have conversations, really get to know what makes them tick, really understand what their interest areas are, so that if you're going to start a dialogue with your staff, then you have something to talk about and can really break the ice if things change. It also works really well for you to identify that baseline that I was just talking about with your staff. On the other side, when you're looking at managing yourself, I think it's also really important that you share and your staff and your team really understand who you are. And it's really important to be able to look, everyone's got their level of comfort to be able to talk about their own issues and what's going on, or disclosing what's happening for them. But I think the power of story is really important. And I think if you're able to share examples or scenarios with your team, then maybe it might open up that dialogue. It also might allow for your staff members to feel comfortable to have a conversation with you or to approach you and to be able to say, Mostapha, I've noticed that you've been a little bit off, or you've been a little bit pushy this week, or, there's been some challenges, or we're missing our targets or our deadlines, or whatever it might be as well. So I think from that personal level, I think that's a really great way to be able to manage ourselves. But then also looking at what are our deliverables? What are our outcomes? Am I meeting those targets? If I'm falling behind on some of those targets, if I'm not meeting those, then maybe that is one of the signs that maybe I need some help and support. Sometimes we need to manage up, but sometimes we can manage down too. So really important that we recognize that as a leader, you have to have a multifaceted approach to all of your work, and having those relationships with your peers. So maybe it might be a fellow manager who might be dealing with a similar project. You can bounce some ideas off them. A lot of the EAP programs, the employee assistance programs, have a capacity to do a manager assist. And what that is like a coaching support service for leaders that they can have a conversation with them. So if there's times when you're finding it a little bit challenging for you, you can reach out to them and say, hey, I'm struggling with this particular issue. As a leader, I'm supposed to have all the answers. I'm supposed to know everything. Right now, I don't. Do you got any tips for me? And certainly that can really help you out. So, don't be afraid just because you have the title of a manager or a leader that you have to know everything. We're not expecting everyone to be an expert at everything. Okay, whilst you might be a leader in your own particular field, and you might be the subject matter expert as an engineer or as a rail fitter or signaller or whatever it might be. But sometimes managing people and managing the expectations of people might also be a difficult area. So don't be afraid to reach out if you do need that support and to ask for some help.
I think that's a really good reminder about the EAP program is there to help managers in their skill development too. I don't think that's something that most people think of. They think of it more as a personal assistance dealing with personal issues. Mostapha, over the last couple of years, misinformation, false truths, and similar have been part of the new vernacular, and there's been a lot of information that we've heard, a lot of it really negative, a lot of it really quite scary, and delivered in such a way that it is to generate a really negative reaction in us. What are your sort of tips and thoughts on, I suppose, trying to manage your own anxiety by not looking or taking to heart some of this misinformation that we have out there?
I think, Heather, in these times, and I mean, we spoke right at the start of our chat about technology and having access to information. Sometimes we don't know the information, whether or not it's accurate or being fact checked. So I think it's really important that if we, see something, not to just take it on face value and just believe it. Do your own little bits of research and try and find out a bit more information. Find out about the source. Find out about who is sharing this information. Now, if it's something that's come from the health department, sure. Find out why it's come in place, how it's come in place, and what the objectives and the aims of that particular policy or process, the foundations for it. Obviously, the health advice that we've been receiving at the moment has gone through its very many rigors to ensure that it's accurate and consistent with what we need in terms of managing this particular pandemic. My wife is recently completed her PhD, and she talks endlessly about all the research and things that she's had to do. And anytime we see something come up, she's straight away on her sources and going, yep, I need to fact check. I need to make sure that this is all accurate and correct. And so from her perspective, she's always encouraged, to really look deeper and look beyond what it is that you're looking at, just to make sure. And again, when it comes to seeing things, you look at things on face value and just think, wow, that's really terrifying. I don't know how that's happened, what's going on there. And then trying to manage your anxieties around that is reassuring yourself that the information that you're being provided is correct, it is accurate, and it's come from a reliable source.
If you feel like your well-being's being impacted by your workplace or your manager or your other colleagues, so what do you think's the best approach for somebody to take?
Look, certainly having a conversation with your leader is probably the first place to start, and just having a bit of a chat and just opening that conversation and dialogue and saying, look, this particular environment is not conducive to me right now. I'm going to need your help and support to improve things. So really trying to understand what it is about that particular situation that isn't helpful for you. What is it about that environment that's not helpful for you? Is it the people? Is it the workload? What exactly is going on for you so that you can accurately detail to your leader what's going on? You can then probably navigate through an effective strategy to help you to overcome some of those challenges and some of those barriers that you might be faced with, but certainly opening up that dialogue. And look, if you've got peers, sounding those ideas off them as well and just asking, hey, how are you coping with this particular thing? Or what do you think about this particular scenario? And then they might give you some feedback and some advice and saying, oh, you know what, Mostapha, I'm actually going through the same thing at the moment. I'm really finding that quite challenging. And then maybe, having that conversation. Okay, what do you do about it? How do you deal with it? How do you manage it? What are you, proposing as a way to overcome that challenge? So really having strong networks is always going to be the first step and the best way to probably tackle any of those challenges. And look, communication is the key. If you're not telling anybody, no one's going to know. Sometimes we're going to have to guess and try and find, oh, geez, I wonder what's going on for him. Again, communicate, tell people, talk about it, because that really will help you and open up that scenario for you.
Part of the Are You OK sort of methodology is picking your time to have a conversation with somebody and asking them, are they okay? But then being an active listener to the answer. We've had a question really, which is about sometimes people are asking the question, they're saying, are you okay? But they're not really being an active listener to that person, and so therefore aren't really actually helping them work through those issues or be referred to appropriate help. Can you talk a little bit about active listening and Are You OK and how those things fit together?
Absolutely. Great to hear that people are using the Are You OK methodology. I think that's probably the simplest way. And I think in our interactions every day where we're asking people questions, we're asking people how they're going, we're asking people how their day is and what's been going on for them, how they're coping. So just quickly, for those who don't know what those 4 steps of Are You OK Day are, first is to ask the question, the second is to listen, the third is to encourage action, and the fourth is to check back in. So if we're thinking about how we pick our moments and how we approach having a conversation with someone who might be struggling, first and foremost, we have to think about ourselves. Think about, am I okay to be having a conversation? Am I in the right headspace? Do I have the resources available if things aren't okay for that person? Do I know where to point them in the direction of for further support? The really important thing, and Are You OK, the organisation really emphasises this, is that you don't have to be a professional, you don't have to be an expert, and you don't have to have all of the answers when you are having a conversation, okay? So please rest assured that you don't have to be that expert, but what you have to be is a really good listener. And it's important that you're in the right headspace so that you can actively listen. Now, that active listening is all about trying to understand what's going on for that person. So if you're going to say, hey, how you going? Wait for the person to tell you how they're going. How many times, and I'm going to give you all that are listening this scenario, how many times have we been in that office environment or walking past some of our friends in the street, and we walk past and we go, hey, Mostapha, how you going? And you sort of just keep walking. You don't actually stop to wait and hear how Mostapha's going. It's really important that if you're going to ask that question, wait and let them tell you how they're actually going. Let them tell you what's going on. Ask them, how long have you been feeling this way? Let them answer. Let them give you some more context about what's been going on. When they're telling you, okay, this has been going on for me, okay, what have been the changes? And then once they start to explain to you what those changes have been, how long they've been feeling that way, hopefully that'll give you an idea on how serious that situation is that they're experiencing and maybe the urgency required for some support. So if they say, you know what, I've been struggling to get out of bed most days, I'm hardly eating, I don't want to speak to anyone, I'm really angry all the time, I'm probably thinking, okay, well, if I'm not a psychologist, then maybe a psychologist might be the person who we can refer this person on to. Then maybe saying to that person, have you spoken to anybody about this? Who knows about this? If it's been going on for months and months, have you spoken to anyone? If they haven't, then saying, okay, well, I think it's really important that you do speak to somebody. Do you know who to speak to? If it's a colleague of yours and you have an employee assistance program within your organisation, then encourage them to go and have a chat to the EAP. If they're struggling, to have the confidence to go and speak to somebody, from the EAP, maybe you can be that person that can say, well, would you like me to call them, or would you like me to go with you to that support? So following that process, and then once hopefully they've gone and had that conversation, come back, loop back into them and say, hey, how did you go? How did you manage that? Did you speak to them? Did you get the clarity that you needed? Do you have a plan? Do you have some strategies that you can work with to help you to go forward? So I think really being that active listener really relies and depends on you being in the right headspace and having the clarity to be able to ask how they're going. The other really important thing is that we need to consider the time. Okay, a lot of the times we ask that question and we've got things to do, we've got places to go, places to be. Really think about, okay, do I have the time? Because sometimes you start a conversation and it could be just a casual chat, and then it turns into something a little bit more elaborate, and they're going on about how this has been a really difficult time, what the potential impacts have been for them. Or maybe you need to stay with them, make sure that they are safe and make sure that they are okay, and make sure that they're being referred on to the right supports as well. So I think that's a really great question, and really important that people recognise that, if people are going to ask, then be there and reciprocate and listen. Now, if you're finding that the person that you're speaking to, so if we flip it around and you're the person who's sharing and saying that I'm struggling, and you feel like that person's not listening, say to them, hey, thanks, appreciate you reaching and asking. I'm not getting what I feel like I need to from you. Take that to somebody else. Go and approach somebody who you do trust, someone who you do get along with, someone who you feel like you can communicate a little bit better with, and someone who might reciprocate that response that you're looking for. Certainly the EAP, I can't emphasize it enough, is a great place to start that conversation. Go to your GP, they've got a great network of clinicians and specialists that can help you out, if it's a particular issue. So for example, I might have a psychologist that is really great at supporting people with anxiety. The GP can point you in that direction. If it's someone who's looking at, say, for example, postnatal depression, they might have a specialist psychologist who can help them deal with that. So really speak to your GP. They're a great support for various bits of knowledge as well. So strongly encourage you to reach out to them if you're not getting that reciprocation from a friend or colleague who's asked you in the first place if you're going okay.
And just a reminder to everybody that there are a whole lot of Are You OK resources on the Are You OK website. TrackSAFE has some on its website as well. And just at a day-to-day level, the free mobile app RailRes is also something that you might find really helpful in managing stress, and particularly in this time where things are going to be a little bit uncertain, to help you put things in perspective and do some deep breathing exercises, get your mind into a more positive place. We're coming to the end of our conversation today, Mostapha, so I'd like to thank you very much for spending time with us and sharing your thoughts based on years of experience on working on wellbeing and in the rail industry. And I hope everyone listening, you can walk away with at least one thing that you can put into practice in the next couple of days, because as Mostapha was talking about, we need to have a bit of a routine and to plan. And I think if you can plan to do just one thing in the next couple of days to build your resilience and, in the coming days, weeks and months, that will be really good for you. As part of the suite of mental health and wellbeing activities that TrackSAFE delivers, we're working with Lifeline to deliver the Accidental Counsellor course. It's a 5-hour course delivered online on the 15th of November. There's more information on our website, and I do encourage you, if you are interested, to get in contact with us just in the next few days as to take it up your place. Following the webinar, there'll be a short survey distributed. We really do encourage you to give us your feedback. Alternatively, we're all very adept at using QR codes now. You can click on the QR code on the screen and give us your thoughts. I'll see you at our next webinar. And of course, ARA has many other webinars on a whole range of topics coming up, and more information is on their website. Thank you again, Mostapha. Thank you again, everybody that's on the line, and good afternoon.